You may have heard of the disease from famous people that have had it, such as Robin Williams, Muhammad Ali, and Pope John Paul II. But what is Parkinson's disease? Parkinson's disease is a neurodegenerative brain disorder that forms when the brain stops producing a certain neurotransmitter called dopamine. Dopamine regulates movement, pleasure and pain, emotions, memory, attention, and more. The disease itself is not fatal, but its symptoms can lead to other issues. For example, Parkinson's patients can have difficulty swallowing, which leads to inhalation of food into the lungs, causing pneumonia. Patients can also lose balance easily and seriously injure themselves if they fall. How is it discovered? Parkinson's disease was first discovered in 175 AD and called shaking palsy, but it wasn't officially published as a medical condition until 1817, when Dr. James Parkinson wrote an essay on the shaking palsy. However, the dopamine deficiency in Parkinson's patients' brains was only recently discovered in the 60s. All about dopamine. Dopamine is defined as a neurotransmitter produced by the brain that acts as a chemical messenger between brain cells. When a person is addicted to drugs, alcohol, gambling, etc., their brain releases dopamine at a higher rate, and the addict becomes obsessed with the rewarding feeling. On the other hand, when a person has a dopamine deficiency, their brain doesn't produce enough dopamine, which can lead to depression, rapid weight gain, trouble focusing, and Parkinson's disease. Now, scientists are trying to figure out what genetic and environmental problems could possibly cause dopamine to slowly stop. So far, scientists may have found a gene that increases the risk of Parkinson's disease, but no genes that guarantee the disease have been found. There are questions over whether the transmitters stop producing as a result of aging, but people under 40 years old have also been diagnosed with young-onset Parkinson's disease, so the question is still unsolved. There are multiple symptoms of Parkinson's disease. Motor symptoms, having to do with movement, include tremors, slowness of movement, stiffness, and trouble with balance. As the disease progresses, these issues can advance into more serious problems, where a person is confined to a wheelchair or a bed. Non-motor symptoms include constipation, mood changes, and sleep disorders. Treatments. Currently, there is no cure for Parkinson's disease, but there are treatments such as medication and physical therapy. Some medications help lessen motor symptoms by providing dopamine to the brain. However, as the motor symptoms can be severe, most medications need to be taken multiple times a day. Also, just as any other medications, there are several negative side effects, such as dizziness, muscle pain, or worsening of spasms. How many people are affected? Parkinson's disease affects around 1 million people, of which there are 50% more men than women, and doctors diagnose another 60,000 patients every year.